Osteoarthritis, OA. Arthritis is a general term that means inflammation of the joints. Osteoarthritis, OA, is the most common form of arthritis. Some people call it degenerative joint disease or wear and tear arthritis. It is associated with a breakdown of cartilage in joints and can occur in almost any joint in the body. It commonly occurs in the weight-bearing joints of the hips, knees, and spine. It also affects the fingers, thumb, neck, and large toe. With osteoarthritis, the cartilage within a joint begins to break down and the underlying bone begins to change. These changes usually develop slowly and get worse over time. Osteoarthritis can cause pain, stiffness, and swelling. In some cases it also causes reduced function and disability. Some people are no longer able to do daily tasks or work. Osteoarthritis usually does not affect other joints unless previous injury, excessive stress or an underlying disorder of cartilage is involved. There are two main types of osteoarthritis. Primary, most common, generalized, primarily affects the fingers, thumbs, spine, hips, knees, and the great, big, toes. Secondary, occurs with a pre-existing joint abnormality, including injury or trauma, such as repetitive or sports-related. Inflammatory arthritis, such as rheumatoid, psoriatic, or gout, infectious arthritis. Genetic joint disorders, such as Ehlers-Danlos, also known as hypermobility or double-jointed, congenital joint disorders, or metabolic joint disorders. Cartilage is a firm, rubbery material that covers the ends of bones in normal joints. Its main function is to reduce friction in the joints and serve as a shock absorber. The shock-absorbing quality of normal cartilage comes from its ability to change shape when compressed, flattened or pressed together. Osteoarthritis causes the cartilage in a joint to become stiff and lose its elasticity, making it more susceptible to damage. Over time, the cartilage may wear away in some areas, greatly decreasing its ability to act as a shock absorber. As the cartilage deteriorates, tendons and ligaments stretch, causing pain. If the condition worsens, the bones could rub against each other. Symptoms of osteoarthritis. Osteoarthritis symptoms often develop slowly and worsen over time. Signs and symptoms of osteoarthritis include joint aching and soreness, especially with movement, pain after overuse or after long periods of inactivity, stiffness after periods of rest, bony enlargements in the middle and end joints of the fingers, which may or may not be painful, joint swelling. Causes of osteoarthritis. Osteoarthritis occurs when the cartilage that cushions the ends of bones in your joints gradually deteriorates. Cartilage is a firm, slippery tissue that enables nearly frictionless joint motion. Eventually, if the cartilage wears down completely, bone will rub on bone. Wear and tear. Osteoarthritis has often been referred to as a wear and tear disease. But besides the breakdown of cartilage, osteoarthritis affects the entire joint. It causes changes in the bone and deterioration of the connective tissues that hold the joint together and attach muscle to bone. It also causes inflammation of the joint lining. Pain. Affected joints might hurt during or after movement. Stiffness. Joint stiffness might be most noticeable upon awakening or after being inactive. Tenderness. Your joint might feel tender when you apply light pressure to or near it. Loss of flexibility. You might not be able to move your joint through its full range of motion. Grating sensation. You might feel a grating sensation when you use the joint, and you might hear popping or crackling. Bone spurs. These extra bits of bone, which feel like hard lumps, can form around the affected joint. Swelling. This might be caused by soft tissue inflammation around the joint. What are the risk factors for osteoarthritis? Joint injury or overuse, such as knee bending and repetitive stress on a joint, can damage a joint and increase the risk of OA in the joint. Age. The risk of developing OA increases with age. Gender. Women are more likely to develop OA than men, especially after age 50. Obesity. Extra weight puts more stress on joints, particularly weight-bearing joints like the hips and knees. This stress increases the risk of OA in the joint. Obesity may also have metabolic effects that increase the risk of OA. Genetics. People who have family members with OA are more likely to develop OA. People who have hand OA are more likely to develop knee OA. Race: some Asian populations have lower risk for OA. Complications of osteoarthritis. It's well known that arthritis, including OA, can cause physical complications. OA can cause emotional complications too. Physical complications include poor sleep, weight gain as a result of pain or limited mobility, osteonecrosis, or bone death, erosion of the ligaments and tendons, hairline, stress, fractures, hemarthrosis, or bleeding near the joints. Emotional complications include anxiety and depression brought on by the loss of function. Severe osteoarthritis. Osteoarthritis is a progressive condition with 5 stages from 0 to 4. The first stage, 0, represents a typical joint. Stage 4 represents severe osteoarthritis. Not everyone who has osteoarthritis will progress all the way to stage 4. The condition often stabilizes long before reaching this stage. People with severe osteoarthritis have extensive or complete loss of cartilage in one or more joints. Severe osteoarthritis symptoms. The bone-on-bone friction associated with this can cause severe symptoms such as increased swelling and inflammation. The amount of synovial fluid within the joint may increase. Normally, this fluid helps reduce friction during movement. However, in larger amounts, it can cause joint swelling. Fragments of broken-off cartilage may also float within the synovial fluid, increasing pain and swelling. Increased pain. You may feel pain during activities and also when you're at rest. You may feel an increase in your pain level as the day progresses, or more swelling in your joints if you've used them a lot throughout the day. Decreased range of motion. Due to stiffness or pain in your joints, you may not be able to move as well. This can make it harder to enjoy the day-to-day activities that used to come easily. Joint instability. Your joints may become less stable. For instance, if you have severe osteoarthritis in your knees, you may experience locking, sudden lack of movement, or buckling, when your knee gives out. Buckling can cause falls and injury. Other symptoms. As a joint continues to wear down, muscle weakness, bone spurs, and joint deformity may also occur. The joint damage caused by severe osteoarthritis isn't reversible, but treatment can help reduce symptoms. Osteoarthritis versus rheumatoid arthritis. Osteoarthritis and rheumatoid arthritis, RA, share the same symptoms but are very different conditions. Osteoarthritis is a degenerative condition, which means that it increases in severity over time. Rheumatoid arthritis, on the other hand, is an autoimmune disorder. People with rheumatoid arthritis have immune systems that mistake the soft lining around joints for a threat to the body, causing the body to attack that area. This soft lining, which includes the synovial fluid, is called the synovium. As the immune system launches its assault, fluid buildup within the joint occurs. This causes stiffness, pain, swelling, and inflammation. If you're not sure which form of arthritis you have, your best bet is to talk with your doctor. You can also do your own preliminary research. Take a closer look at the differences between rheumatoid arthritis and osteoarthritis. Diagnosis of osteoarthritis. During the physical exam, your doctor will check your affected joint for tenderness, swelling, redness and flexibility. Imaging tests. To get pictures of the affected joint, your doctor might recommend X-rays. Cartilage doesn't show up on X-ray images, but cartilage loss is revealed by a narrowing of the space between the bones in your joint. An X-ray can also show bone spurs around a joint. Magnetic resonance imaging, MRI. An MRI uses radio waves and a strong magnetic field to produce detailed images of bone and soft tissues, including cartilage. An MRI isn't commonly needed to diagnose osteoarthritis but can help provide more information in complex cases. Lab tests. Analyzing your blood or joint fluid can help confirm the diagnosis. Blood tests. Although there's no blood test for osteoarthritis, certain tests can help rule out other causes of joint pain, such as rheumatoid arthritis. Joint fluid analysis. Your doctor might use a needle to draw fluid from an affected joint. The fluid is then tested for inflammation and to determine whether your pain is caused by gout or an infection rather than osteoarthritis. How is osteoarthritis treated? There is no cure for osteoarthritis. Mild to moderate symptoms are usually well managed by a combination of pharmacologic and non-pharmacologic treatments. Medical treatments and recommendations include medications, topical pain medicines and oral analgesics including non-steroidal anti-inflammatory medications, NSAIDs. Exercise, land and water-based. Intermittent hot and cold packs, local modalities. Physical, occupational, and exercise therapy. Weight loss, if overweight. Healthy eating, managing diabetes and cholesterol. Supportive devices such as braces, orthotics, shoe inserts, cane, or walker. Intra-articular injection therapies, steroid, hyaluronic acid gel. Complementary and alternative medicine strategies, including vitamins and supplements. Surgery may be helpful to relieve pain and restore function when other medical treatments are ineffective or have been exhausted, especially with advanced osteoarthritis. The goals of treatment are to decrease joint pain and stiffness and delay further progression. Improve mobility and function. Increase patients' quality of life. The type of treatment regimen prescribed depends on many factors, including the patient's age, overall health, activities, occupation, and severity of the condition. Medications for osteoarthritis. Unlike other forms of arthritis where great advances have been made in recent years, progress has been much slower in osteoarthritis. There are no medications yet available that has been shown to reverse or slow the progression of osteoarthritis. Currently, medications are focused on decreasing symptoms of the disease. Pain-relieving medications include acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs. Narcotic pain medications are not recommended due to the chronic nature of the disease and the possibility of tolerance and addiction. Topical medications in the form of analgesic patches, creams, rubs, or sprays may be applied over the skin of affected areas to relieve pain. Although many of these medications are available in over-the-counter preparations, individuals with osteoarthritis should talk to your doctor before taking the medications. Some medications may have dangerous or unwanted side effects and/or may interfere with other medications that are being taken. Some over-the-counter medications still require routine laboratory testing. The antidepressant duloxetine hydrochloride, Cymbalta, was approved by the FDA in 2010 to treat the pain of osteoarthritis, such as lower back pain. That has been a big help for people who can't tolerate NSAIDs or other treatments. Supportive devices for osteoarthritis. Supportive or assistive devices help decrease stress on affected joints. Braces and orthotics help to support and stabilize painful, damaged joints. Medical devices should be used as instructed and under the direction of a health professional such as a physical/occupational therapist or your licensed healthcare provider. Shoe lifts/inserts, a cane or a walker may be helpful to take pressure off certain joints and improve body and gait mechanics. Exercise is important to improve flexibility, joint stability and muscle strength. Regimens such as swimming, water aerobics, and low-impact strength training are recommended. These have been shown to decrease the amount of pain and disability that osteoarthritis sufferers experience. Excessively vigorous exercise programs are best avoided, as they may increase arthritis symptoms and potentially hasten the progression of the disease. Physical therapists or occupational therapists can provide appropriate and tailored exercise regimens for individuals with osteoarthritis. Hot and cold therapies. Intermittent hot and cold treatments may provide temporary relief of pain and stiffness. Such treatments include a hot shower or bath and the careful application of heating or cooling pads or packs. Weight control. Since obesity is a known risk factor for osteoarthritis, working to better manage weight may help prevent and improve osteoarthritis. Weight loss in overweight persons who have osteoarthritis has been shown to reduce stress on the joints. It also reduces the amount of pain in weight-bearing joints as well as moderates the inflammatory processes that contribute to osteoarthritis. Surgery. When osteoarthritis pain cannot be controlled with medical management and it interferes with normal activities, surgery may be an option. Surgery is usually reserved for those people who have significant osteoarthritis. Several types of techniques can be employed, including minimally invasive joint replacement techniques. Although it has risks, joint surgery today can be very effective at restoring some function and reducing pain for appropriate individuals. Alternative medicine for osteoarthritis. They include nutritional supplements, vitamins, minerals and other compounds sometimes referred to as natural, homeopathic, or alternative therapies. Glucosamine and chondroitin are components of normal cartilage. As a supplement, they are most widely available as sulfate compounds. Clinical research results on glucosamine and chondroitin seem to vary, however, some trials indicate possible pain-relieving properties, particularly in osteoarthritis of the knee. Exactly how they work remains unclear and there is no strong scientific evidence supporting the claim that they build bone and cartilage. In general, glucosamine and chondroitin appear to be safe and well tolerated, however should first be discussed with your healthcare provider. Fish oils have some anti-inflammatory activity, but these oils have been studied more extensively for rheumatoid arthritis. Supplements can potentially interact with prescription medicines and can have side effects. They should always first be reviewed with your healthcare provider. Other modalities of alternative medicine include acupuncture, acupressure and meditation.